Alcohol plays a huge role in violence. Having treated a lot of facial trauma patients in the west of Scotland over many years, it plays a really significant role in most of those injuries. We see probably about 70% of the patients coming through the clinic doors are assaulted as a result of violence, and probably over 80% of those patients will have been drinking at the time that they've been assaulted. So a very significant role both on the part of the victim, who obviously we would see, but also on the part of the perpetrator, who's often also been drinking at the time. And I think if I had £1 for every patient that had said to me, I just didn't see it coming because I'd been drinking, I'd be a very rich woman. A lot of alcohol-related violent incidents take place in public places, in my experience anyway, from the patients that we see. So very often it's been patients who've been in the pub, may have been assaulted outside the pub, or in nightclubs, or in the street, in fact. So that's where most of them take place, but I think increasingly, because of the smoking ban probably, which has obviously been a good thing, but increasingly people are drinking in their own home, and that means that sometimes these incidents are now occurring in homes, and that's something that the police would see more of now as the locus for an incident. The typical patient with a facial injury where violence has been an issue would be a young man, probably in his 20s, who has been on a night out and has been assaulted as part of that. They almost inevitably will have been drinking, and drinking to excess. And that's something that, we see very, very commonly. And something that we've tried in the clinic to do something about. We have an alcohol nurse who works in the clinic now and provides brief interventions for these patients, which have been shown to be very effective at helping our patients to reduce their drinking for the future. Unfortunately, it doesn't prevent that first incident from happening. So that's something that we probably need to think about addressing in other ways. It's imperative that we do something to address alcohol amongst this group of trauma patients, and indeed other groups of trauma patients, because I think you'll find if you look at accident and emergency, many of the patients that come into orthopaedics and plastic surgery, they'll have the same issues in relation to alcohol. Medics Against Violence was set up in 2008 by myself and some colleagues who all worked in maxillofacial surgery. And I think the reason that we set it up really was because we became increasingly conscious that we were very good at patching people up and sending them on their way, but we were really doing nothing to address the root causes of violence. And that's what we tried to do with this programme. So a big part of our programme is in schools, where we go into schools and we talk to young people about the consequences of violence. And one of the things that we're very keen to speak to them about is alcohol, because we're very clear that alcohol has a big role in most incidents of violence. It's unusual for alcohol not to have been involved in some way. And I think the one thing that we are seeing now is that young people are very much changing their attitude to violence. They're not carrying knives as much, they're not getting into gang-related violence as much. But the one common denominator for all of them is that they will start drinking, in their late teens. And it makes them much less aware, much more impulsive, much more likely just to end up in a situation that they would rather not be in. So we talk to them a lot about alcohol, about drinking sensibly, about trying to keep your wits about you, about looking out for your friends when you're out drinking. And hopefully we'll get that message across to them. One thing that I think would make a difference definitely would be minimum unit pricing. I think one of the problems for a lot of our patients is that they are drinking in the house before they go out. And while many of them are assaulted on their night out, so they're in a public place, we know that many of them preload with alcohol before they go out. And the fact is, you can go into a supermarket and buy huge quantities of very cheap alcohol, any day of the week. And addressing that, I think, would be something that would make a massive difference to this group of patients.